Hello, everyone, and thank you for joining us today for our webinar on COVID-19 solutions to continue to flatten the curve, return to work, and manage vaccines. We're thrilled to have as our speakers Kathleen McGrow, the Chief Nursing Information Officer for Microsoft, and Sara Camden, our Product Manager here at Mazik Global. And before getting started, I just want to go through some housekeeping items. You're all in listen-only mode for the webinar, but if you do have a question, please hit the control panel to raise your hand or type the question in the chat box. We'll answer the questions as appropriately as we can during the webinar, though we may hold some of them until the end. Thank you to those who had submitted a question in advance. We will be addressing those during the Q&A portion of the webinar. We are recording this webinar and we will post it on the Mazik Global website. It'll be in our resources webinar section. Do expect to have it posted by end of day tomorrow, and I'll send an email out to all attendees and registrants to let you know that that's been completed and where you can access it. And now I have the honor and privilege to introduce our speakers. Dr. Kathleen McGrow, as I said, the Chief Nursing Information Officer for Microsoft. Dr. McGrow brings a wealth of experience in data analytics and artificial intelligence to drive best practices for use of artificial intelligence for critical care cases and the overall improvement of patient outcomes. She brings a depth of experience not just from Microsoft, but from other top organizations like Johns Hopkins, University of Maryland Trauma Center, GE Healthcare, and Philips, to name a few. I'd also like to introduce Sara Camden, our Product Manager of Healthcare here at Mazik Global. Sara brings a deep healthcare experience for Dynamics 365 implementations for healthcare customers, as well as development of the Mazik Care suite of products. She's also currently working toward her Master of Science in Health Informatics. And I want to thank you both for speaking today and sharing your knowledge. And with that, I'll turn it on over to Kathleen.
Thanks, Sue. I'm happy to be here and speaking about COVID-19 solutions to continue to flatten the curve and return to work. So if I can ask you just to go ahead and advance the slides. And we can keep going through these. Yep. So these are the intro slides. Great. We can go to the next slide and actually probably even the next slide. So this is perfect right here. So today I'm going to be covering some of the current COVID-19 case and test data, COVID-19 vaccine to vaccination recommendations and approaches. And I think everyone knows we still have a long way to go. And the more we learn, the more we need to learn. So when we think, if you can just go back one slide, Sue, if that's okay, I think we just skip forward a little bit. Thanks. So when we think about the ultimate goal of hospitals and healthcare providers, why we exist and get up each morning and go to work, it can be summed up in one goal: to provide our patients the best care possible and give our providers the best solutions to enable this care. From doctors to nurses, social workers and support staff, managers and executives, we all want to make sure that we give every patient quality care and that our clinicians are equipped and empowered to do so. Microsoft is committed to the health industry because optimal health is necessary to achieve our corporate mission, which is to empower every person and every organization on the planet to achieve more. This includes people and organizations that are focused on providing healthcare. As we know, people are best able to achieve more when they're in their best of health and well-being. We also know that we cannot achieve our mission alone, which is why we're committed to working with the industry, our partners, and customers to realize our mission. Next slide, please. There are two sets of discrete but interrelated forces driving change and disruption in healthcare now. Healthcare organizations are being squeezed by plummeting income and climbing COVID-19 expenses due to canceling profitable elective surgeries. Many hospitals are also seeing costs rise due to overtime, contract workers, and higher prices for supplies. Hospitals and health systems are bracing themselves for system-wide disruption by announcing temporary layoffs, reassignments, and pay cuts. With razor-thin margins to start with and small amounts of cash on hand, many hospitals may fail or seek a partner for M&A to survive. Healthcare organizational leaders must now begin shifting from managing the crisis, keeping the organization functioning, to managing the transition back to a restored future. That means that preparation of mid and long-term economic and scenario planning to understand the related impacts on operations, employees, financing, supply chain, as well as others. Also, attitude shifts from a primarily reactive mode to anticipating how to reinvent the organization for a successful future. Apart from COVID, at the same time, there are long-term systemic issues that healthcare organizations must address. Just as digital transformation in other industries has led to increased patient expectations, Patients have higher expectations towards their doctors, insurers, and for the treatments they receive. 81% of patients are unsatisfied with their current healthcare experience. 92% of patients now expect any health institution to have full access to their medical history. And 41% of providers say challenges with data and analytics to accurately estimate costs is preventing them from succeeding in value-based care models. As populations age and health needs become more complex, providers are facing a global shortage of workers at the worst possible time. By 2030, providers will suffer from a projected shortage of 14 million workers worldwide. And this is not taking into consideration the concerns that providers have now around COVID. By 2050, this will cause the number of people aged 60 or more to more than double, from 900 million to 2 billion, representing an increase from 12% to 22% of the population. As this large percentage of our population ages, there will be an increased need for more care coverage to address growing elder care needs. To keep healthcare data secure, health organizations have to prioritize security and compliance, especially with the threat of ongoing high-profile data breaches and identity theft. Currently, the global health industry loses $6.2 billion per year to data breaches, putting patients at risk and straining already tight budgets. With so much data expected to be available so soon, health executives are anticipating the transformative power of new technologies. 70% of hospital healthcare executives agree that keeping up with trending technologies may not only give them a competitive advantage, but is essential to growth and a positive customer experience. 48% of healthcare executives say the biggest obstacle of piloting digital transformation initiatives is lack of mature technology. So you can go ahead, Sue, to the next slide. I would like to spend just a little bit of time speaking to the COVID-19 cases and testing data. I'm mainly going to be focused on the US data. You can go to the next slide, Sue, please. I am sure many of you are familiar with the Johns Hopkins Coronavirus Resource Center. And I'll be honest with you, I pulled this data just on the 25th, just 2 days ago. These are the latest snapshots of the all-up global cases and numbers by country. The latest is that global cases have exceeded 100 million. So 2 days later, we're already up over 1 million people. The global deaths on the right has exceeded now 2.1 million. And the deaths by state and recovered where the numbers are available. This really underscores the need for accurate data. So you can see that there are some states where it's just not available because they don't have the data that they really require to send into the system for us to get an all-up view. Next slide, please. New cases on this slide are essentially presented as daily counts that are reported by each state. So you can see it's 100 tests per 100,000 patients. Due to fluctuations in daily reporting, testing rates are represented as a 7-day rolling average. And as the guidance evolves on COVID-19 case reporting, some states are modifying their reporting to include both confirmed cases based on lab testing and probable cases based on specific criteria for symptoms and exposure it reflects. This may cause new case data to spike. So if states are doing it differently, then we may see different instances around state data. And it's important to note that the quality of testing data also varies by state. Overall, we are not doing very well on widespread testing, which is important with a virus that spreads so easily and have many people that have contracted it, but are asymptomatic. Asymptomatic spread is a huge problem right now. And with moving forward, we will need to ramp up testing to contain the spread. Also, there's concern over new COVID strains. The UK variant has been discovered in as many as 20 US cities. There is one documented case of the Brazilian variant currently in the US. And while the variant in South Africa has not yet been detected in the US for a search, the search for that has only recently started. So most likely it's in circulation somewhere. We just haven't found it yet. Experience so far with new variants is that once they gain foothold, they quickly become a dominant strain. On January 21st, President Biden signed an executive order on establishing the COVID Pandemic Testing Board and ensuring a sustainable public health workforce for COVID-19 and other biological threats. Next slide, please. There are, of course, rapid point of care tests available One of the physicians that I've worked with, he's actually currently working in Germany, and he self-tests frequently at home, and it's resulted at home. And then he can send that test in for verification. I think we need better options for testing, and we need home and point of care testing. This would help tremendously with asymptomatic spread of COVID-19. Next slide. Next, I'm going to dive a bit into the COVID-19 vaccine to vaccination strategy and processes. By no means is this complete. There is a ton of information out there, so I tried to compile as much for the amount of time that I had available. Next slide. I need to mention that calls have been made for equitable vaccine distribution. On January 20th, the World Health Organization, the WHO, stated that equitable vaccine distribution is at serious risk. The concern is that many of the vaccinations are going to wealthy nations, leaving poorer countries unable to gain access to any vaccines. In addition, the stringent supply chain and refrigeration requirements also means developing nations may not have the assets required for the vaccines that are currently available. We need to take a long look at how to include developing nations, as this is a global pandemic and needs to be addressed globally. Even in the US, we are hearing stories of people trying to skip the line, which is not fair to those who are at greatest risk. Next slide. Operation Warp Speed was the public-private partnership initiated by the US government to facilitate and accelerate the development, manufacturing, and distribution of COVID-19 vaccines, therapeutics, and diagnostics. The initial funding was $10 billion. OWS's goal was to produce and deliver 300 million doses of safe and effective vaccine. Initial doses were available in December of 2020. And this was part of a broader strategy to accelerate, as I said, development, manufacturing, and distribution of the vaccine, therapeutics, and diagnostics. OWS, the terminology was retired upon President Biden's executive order signing, and I'm going to talk about this in a minute. On December 11th, the FDA issued an emergency use authorization for Pfizer-BioNTech's COVID-19 vaccine candidate, allowing the vaccine to be distributed in the US for people 16 years and older, including healthy individuals. And then on December 18th, the FDA issued an EUA for Moderna's COVID-19 vaccine candidate. That was the second COVID vaccine authorization. And that was for adults age 18 and older. The FDA found for the EUA, the totality of the available data provides clear evidence that the known and potential benefits outweigh the known and potential risk, supporting both vaccines use in millions of people. As of January 21st of this year, President Biden signed multiple executive orders. The plan starts with a national vaccination campaign in order to meet the president's goal of administering 100 million shots, which has been enough to cover 50 million Americans with vaccines that require 2 doses in his first 100 days of office. This has now been increased to 150 million shots in 100 days. The policy to control COVID-19 includes a government-wide unified approach, including establishing a national COVID-19 testing and public health workforce strategy, working to expand supply of tests, bringing test manufacturing to the United States, enhancing laboratory testing capabilities, expanding the public health workforce, supporting screening testing for schools and priority populations, and ensuring clarity of message about the use of testing and insurance coverage. Creating a pandemic testing board establishes and ensures a sustainable public health workforce for COVID-19 and other biological threats. So this is establishment of a pandemic testing board and supporting and implementation and oversight of the policy, which includes the coordination at the federal level to promote COVID-19 diagnostic, screening, and surveillance testing, prioritizing the federal government's assistance to state, local, tribal, and territorial authorities in order to expand testing and reduce disparities in access to testing, and identifying barriers to access and use of testing and increasing testing for priority populations, including healthcare workers and other essential workers, communities with major shortages in testing availability and use, and then at-risk settings, which include long-term care facilities, correctional facilities, immigrational custodial settings, and schools and childcare settings, food processing and manufacturing facilities, and then high-risk groups, including people experiencing homelessness, migrants, and seasonal workers. Following closely behind the mRNA vaccines are 2 vaccines undergoing testing that use adenoviral vectors. The AstraZeneca vaccine uses a chimpanzee-derived adenovirus, and the Johnson & Johnson Janssen vaccine uses a human adenovirus. These are replication incompetent viral vectors in which part of the viral DNA has been deleted and the DNA of the SARS-CoV-2 spike protein has been inserted. These vaccine vectors can enter host cells and express the spike protein, but are unable to replicate. They are most likely ready to file for the FDA in the near future. AstraZeneca data may be submitted as early as the spring and the April timeframe, and then the Johnson & Johnson Janssen is actually looking at the end of January. I haven't heard anything about that, and we're towards the end of January now, so hopefully that will be the next one. J&J has actually committed to deliver at least 1 billion doses by the end of the year. And this charts a good high-level view of the two currently available vaccines and those that are in development. Note the doses and intervals, as well as the storage and temperature are important characteristics to understand. Next slide, please. Vaccine distribution is the key to saving lives and hastening economic recovery. Multiple industries will be responsible for the various pieces of this urgent Herculean effort, but each can benefit from the use of technology. So getting any new supply chain up and running takes time, as the COVID-19 vaccine supply chain has demonstrated. The significant cold chain requirements for both Pfizer and Moderna vaccines have created severe supply chain challenges. Special freezers and dry ice are needed to keep the vaccine stable while in transit and during storage, creating logistical speed bumps. With the major cold chain requirements, vaccines packaged in 5 or 10 dose vials must be thawed in advance for administration. This requires careful planning and scheduling for those targeted for immunization. For example, if a clinic schedules 25 people during an immunization session and only 22 show up, are those doses discarded? Are others available to be vaccinated on short notice? The solution used by airlines to ensure they fill as many seats as possible on every flight is overbooking. By scheduling more people for an immunization appointment than vaccines are available, few, if any, vaccines will get wasted. But people should be alerted that it's possible beforehand so they can be prepared if they need to reschedule. The key point is to ensure no vaccine doses are wasted, given the limited supply available and their enormous societal value as a public asset. Next slide, please. The Center for Disease Control and Prevention recommended prioritization of immunization, that it's important, with Tier 1 people in the most need of immunization. As an update to the ACIP, the Advisory Committee on Immunization Practice, recommendations for vaccinations were in phases. So you can see phase 1A, 1B, and 1C. We are currently, depending on where you live, you may possibly be in 1B or you may be in 1C. And then you can see the additional phases, phase 2 and phase 3. Next slide. Since administration of the COVID-19 vaccine will require a phased approach, there is also a projected time for when doses will be limited. What do we do if we reach a time where limited doses are available, but it happens multiple times, which is probably what's going to happen. Given all the challenges with getting the first dose of the vaccine, managing the second dose will be even more difficult. During the 3 to 4 week period after the first dose, anything from cold chain failure to delayed shipment of new vaccine stockpiles may lead to insufficient vaccines being available. And some people may simply forget to return for their second dose, requiring rescheduling and further delays. All glitches invariably result in the potential of being a point of failure. A recent example of a glitch was when almost 2,000 doses of Moderna's COVID-19 vaccine were spoiled, when a cleaning contractor accidentally loosened a plug on a freezer in a Boston hospital. The pharmacy staff found the freezer holding 1,900 doses of the vaccine had failed and the doses were compromised. The freezer was in a secure location and had an alarm system installed. The plug was found loose after the contractor accidentally removed it while cleaning. So this is an example where fail-safe measures were not triggered, and not enough was done to ensure this event was prevented. I think we'll hear about many more of these occurring, and hopefully we'll learn from each one of them. The Center for Disease Control and Prevention recommended prioritization of immunization is important, with Tier 1 people in most need of immunization. What is also clear is that those who would benefit the least from immediate immunization is those that are 15 years and under. This large group of about 200 million people are in between and are more difficult to rank, order, and prioritize. Such decisions with CDC guidance have been given to the state and county levels, allowing them to tailor their immunization programs based on each state's need. With over 300 million people to immunize in the US, Getting 2 million people immunized every day with a 2-dose regimen will take us till late fall of 2021 before everyone is protected. The sooner the supply chain issues are resolved and expectations are moderated, the sooner we can get on the road to recovery. Next slide. The following map and chart show the number of COVID-19 vaccination doses administered per 100 people within a given population. Note that this is counted as a single dose and may not equal the total number of people vaccinated, depending on the specific dose regimen, as several available COVID vaccines require multiple doses. Next slide. In the US, the number of people diagnosed with COVID-19 each day plateaued after reaching a peak in late April and then peaked again in late July. But in recent weeks, there has been a new surge of cases across the country. Some of the states that are now experiencing rapid growth of confirmed COVID-19 cases were not among those that experienced large outbreaks earlier in the year. We all know that New York took a huge hit in the spring, and now we're seeing large numbers in California and Arizona, as well as some other states. More COVID-19 cases are being recorded this winter than any other previous period of the pandemic. Many states struggle to administer vaccines at the same rate that the vaccines are shipped. And as the COVID-19 pandemic ravages the US, vaccines have begun to be distributed across the country and its territories. As I mentioned, 2 different vaccines were made available, Pfizer-BioNTech and another from Moderna, and they've been authorized for EUA and are part of the widespread distribution process. Also, as discussed earlier, the CDC made recommendations, but states were on point to prioritize at-risk populations to be vaccinated first, including medical staff, people in nursing homes, and other long-term care facilities. So essentially what has happened is we have this influx of COVID-19 patients that are sick, and now we have states that need to administer vaccinations. So we're really struggling with how we have enough people or the ability to schedule and take care of these patients. The latest data shows that we are currently administering over 1.2 million doses of vaccine per day. Next slide. There are many considerations for governments and world leaders, and they're weighing them up as they decide on the technology that they'll each deploy. There is no single platform. There are many options from multiple companies that address individual elements, but what is needed is a comprehensive, customizable solution that provides an end-to-end platform. A successful strategy for reopening requires governments to build the public health infrastructure needed to slow the spread of COVID-19, while developing and implementing a staged plan for bringing the economy back to life. We are hearing many stories on how thousands of appointments need to be rescheduled due to supply issues. Also, the elderly and those lacking connectivity are struggling in finding locations as well as appointments in order to get their COVID-19 vaccination. Next slide. As this was a novel coronavirus, there was no solutions in place to deal with all the complexities that it has brought. Many organizations have pieces of the solution required, but they have gaps and capabilities that are required and needed as well. It's important to evaluate what you have versus what is needed. Every day, new requirements are identified as many different entities evaluate their needs and their readiness now that vaccines are available and as more vaccines become available. Only an agile solution set will be able to quickly adapt as new capabilities are identified as essential. Next slide. Microsoft has a proven record of COVID-19 rapid response, starting with the CDC and many other examples. We work better with our partners on capabilities enabling better experiences, better insights, and better care that leverage the quadruple aim, which includes better health, better care, lower cost, and productivity. Microsoft empowers organizations to achieve more by bringing our technology and products together into experiences that unlock value for our customers. Our value proposition is anchored in trust and scale. For trust, we never compete with you or monetize your data. At Microsoft, we are focused on trust, and we are always empowering, never competing with our healthcare customers or partners. And most importantly, we're not monetizing your data or your patient's data. For scale, Microsoft has industry-leading cloud scale, infrastructure, and partner ecosystem. We have industry-leading scale with over $15 billion invested in a cloud infrastructure and more than 1 million physical servers across 54 global regions. We welcome Mazik Global as a partner, and where we have a very mature partner program with a large partner ecosystem. We have committed at the highest level to respond to this crisis, as Satya Nadella stated. We are adopting a first responder mindset across the company, working with so many customers on the front lines, including governments, health providers, schools, food suppliers, and other commercial customers critical to the continuity and stability of services in every country. Next slide. The Microsoft Cloud for Healthcare brings together two things: our understanding, derived from our research, of the scenarios that are common across the patient care journey, and also our robust, reliable, and secure cloud service into a healthcare-specific cloud solution. Three main scenarios on which we have focused are enhancing patient engagement, empowering health team collaboration, and improving clinical and operational insights. The Microsoft Cloud for Healthcare supports enhancing patient engagement by enabling patient data to flow securely across the care continuum, creating individualized patient experiences, and delivering virtual health tools to facilitate communication between providers and patients, and empowering health team collaboration by making it faster and easier to coordinate care, collaborate on a unified view of the patient, and continually monitoring patient access from remote locations. And by uniting data silos and applying advanced analytics and AI to reveal actionable insights, we can improve clinical and operational insights, thereby enabling better, smarter clinical and operational decisions. For example, you can even trigger automated workflows based on patient and staff actions and predictive analytics. Critically, the Microsoft Cloud for Healthcare is built around protecting health information to support end-to-end security and privacy, manage evolving compliance and regulations, and continually improving data governance and trust. Next slide. As I mentioned, we work with our partners on capabilities to enable better experiences, better insights, and better care that leverage the quadruple aim. Each scenario is supported by three key capabilities that enable transformative experiences and other outcomes across the care continuum. By personalizing care, improving patient insights, and delivering robust virtual health options, you can increase patient satisfaction through enhanced patient engagement. Meanwhile, enhanced care team communication and continuous patient monitoring support stronger, more seamless care coordination and empower collaboration across health teams. And at the heart of it all is open data interoperability. Across your systems unlocks more meaningful, actionable clinical and operational outcomes. Interoperability and integration is crucial. Some of the capabilities, such as remote communication for providers and telehealth, are key, including reaching disparate populations that have access issues. And then artificial intelligence and machine learning technology and the Azure cloud are being brought to bear to empower people to work differently. Next slide. A successful strategy for reopening requires governments to build the public health infrastructure needed to slow the spread of COVID-19 while developing and implementing a staged plan for bringing the economy back to life. The core objectives include system design for fast end user adoption, cloud first, configure first, delivery approach for short implementation timelines, fast data entry and business rules for standardized formatting, such as for patient phone numbers, emails, and date of birth, deployable to any organization or agency and scalable to thousands of users, and a flexible integration design and an extensible platform. Next slide. During this extraordinary time, our responsibility has been to ensure the tools we provide are up to the task of supporting our customers in their time of need. COVID-19, both the pandemic and necessary response, created a new set of operational and clinical challenges for the healthcare industry, of which healthcare providers had to pivot and adjust quickly. This crisis clearly indicated the need for connected views of patients, connecting of care teams, and connecting of secure health data. We worked with the Center for Disease Control in order to deploy a COVID-19 assessment bot that can be quickly deployed and can quickly assess symptoms and risk factors for people worried about infection, providing information and suggesting a next course of action. This was built on the Azure HealthBot framework. St. Luke's University in Pennsylvania has launched a video conferencing tool targeting older patients, the most vulnerable to coronavirus. And Swedish Health launched a COVID-19 emergency response app so that frontline workers can use their mobile devices to keep track of COVID-19 patients, protective gear, ventilator use, and other coronavirus-related information. Next slide. The current state of vaccine to vaccination is concerning and fraught with issues from communication to scheduling through administration. I'm sure we are all seeing many of the same issues. As I said earlier, Microsoft's role is to empower the very organizations and people best positioned to make health and care personal, effective, and affordable. Our partners, our customers, and the people they serve. I'd like to thank you for your time, and I'll now hand it back to Sue. I'm sorry, Sue, are you speaking? Because I cannot hear you.
I was double muted by accident. So thank you so much for
Thank you
mentioning
very
that you couldn't
much.
hear me. So I
Thanks,
just was
Sue.
saying thank you so much for your time and sharing your expertise and the current state of where things are with the pandemic, and certainly all of the issues that as a world we still have yet to unravel and to solve. So thank you. And now I would like to turn this part of the webinar over to our colleague, Sara Camden Howe, who's going to do the demonstration part. Okay, so let me just make Sara the presenter. And Sara, it is all yours.
Thank you, Sue. All right, let me share my screen. Okay, so everyone should be seeing my screen now. Thank you, Kathleen. That was really good context for kind of moving into the solution-oriented side of this webinar, where we'll be talking about the solutions that Mazik Global has created on top of the Microsoft ecosystem, leveraging Power Apps, Dynamics 365, and the cloud for healthcare to kind of try and strategize and bring forth some very quickly deployment-ready solutions to address a number of these pain points within kind of the COVID-19 response continuum, and provide kind of a base for a single platform that can manage a number of these different areas. So we have kind of a full COVID platform that provides testing, scheduling. So this is everything from patient-facing portals, integration with EMRs or HIEs that can send referrals for a test, and then through the actual scheduling of the appointments, appointment fulfillment, and documenting the outcomes of the tests, and then reporting as well. And then from a back to work and vaccine tracking perspective, this is really focused on helping schools and companies kind of who have been working remote to keep on tabs with how everyone is feeling, tracking symptoms, doing contact tracing. And for organizations like healthcare that have been in person this whole time, it's a mechanism for assessing your employees' symptoms, and then if someone is feeling certain symptoms like fever or whatever, you can basically do contact tracing, send notifications for quarantine, and basically manage the overall workforce based on their health symptoms. And then the vaccine management aspect is our newest module that is being leveraged by a number of government agencies and healthcare systems to basically schedule the appointments for not only the providers who are in phase 1A, but also even as a public-facing system for scheduling the appointments and doing the full vaccine fulfillment and reporting to the CDC as well. So those are kind of the main areas that we will be focusing on today. And let me move forward my slides. Yeah, so I'll just dive a little bit more in depth on each of these before I show some of the system as well. So we have kind of this mechanism for assessments. So whether it is patients in the general public who are reporting adverse reactions from the vaccine, whether it is an employee within an organization, we're able to capture easily configurable assessments based on different situations to get symptom data and any other type of kind of questionnaire surveys that you want people to fill out to assess their current situation. So within schools, you know, we have a number of universities that have tens of thousands of students every day reporting their symptoms through this app. And then anyone who reports specific combinations of symptoms will be asked to quarantine. And then there will be a full case management mechanism for contact tracing and follow-up calls from a call center perspective. From a testing standpoint, we're enabling a very simple UI for patients to receive an SMS text message like the one here, where it will link them to a portal and they can select the nearest location, see all of the available appointments at the different locations within a few miles of them, and then they can book an appointment, get their confirmations and reminder text messages and emails, and then from the actual administration side, the people who are giving the test are going to have their own Power App where they can see their appointment list, open it up, scan the QR code from the patient's confirmation message, and then they can document the outcome of the test. And then we have a number of reporting reports created for the kind of CDC and government reporting as well. Then from a back to work, back to school standpoint, these are some of the assessments and dashboards that each employee or student can view in their own Power App, where they can see the latest results from the last survey or assessment that they had taken. They can set up their network with how often they communicate with different other members of the workforce. And you can also send them reminders to take their assessment. So if you're in a situation where people are coming in person, then you can give them a pass that allows them to come on site based on the symptoms that they reported that day. And then we have a full case management functionality as well for contact tracers and individuals who are kind of responsible for following up with anyone who does report positive symptoms or a positive test. And then we can give a lot of powerful analytics via not only the native Power Platform and CE-based dashboards, but also through Power BI, which is natively integrated with the rest of the Microsoft platform. So we have a lot of deep analytics on all of this contact tracing data. And then we also have case management, which can be used through a number of call center functionalities provided by Microsoft, as well as through Microsoft Teams. And then from a vaccine standpoint, we have solutions kind of geared towards different audiences, whether it's kind of a state or a county that's looking to provide public-facing appointment scheduling for their overall constituents, or whether it's a healthcare system looking to schedule the vaccines for their own employees and track the vaccination status of all of their staff and faculty. So we have this eligibility mechanism where you can set up the kind of phase assignment based on different criteria. We have a similar scheduling, so really you can use this platform for both scheduling of the tests and of vaccine appointments. And with the scheduling, we're tracking manufacturers, which dose it is, and then based on the dose, there's a lot of parameters in place to make sure that the second dose is given within the 1 to 28 day time frame. And then we're giving full immunization reporting metrics for the CDC on the overall outcomes and where each individual is in the process of vaccination. Then from an outcome standpoint, we are providing a number of automated surveys that are going out to anyone who receives the vaccine to report on any adverse reactions in case they do have any. And then these are all configurable. So based on different trigger points, you can have the questions be different, or based on whatever your organization wants to ask on certain stages of the process, you can always configure your assessments in this way. So we do provide a number of baseline templates for adverse reactions, as well as general kind of daily symptom checkups, phase assignment, and all of those, but they are completely configurable before or during the implementation process, which we're usually going live within a few days to about 2 to 4 weeks if there are more configuration changes made, but these are really built to be immediately deployable because obviously we're in an urgent situation where we don't have months to go through iterations. So we've really given a broad baseline that can be tailored specifically in a very short period of time. The vaccine management piece also contains an inventory management aspect. So this is where you can track the orders for inventory that have been placed, and then you get the full inventory management capability. You have the available to promise versus consumed, and so forth. And you can actually update the inventory once you receive it on hand. So you have all of those metrics, and you're able to schedule your appointments and fulfill the appointments based on your available to promise and capable to promise inventory. We're also able to track from a full kind of a supply chain management standpoint, the equipment that are on hand, and how, like, the temperature constraints of each of your refrigerators to help you plan out the capacity for storing vaccines. And if you do receive, say, your orders of vaccines from an agency like the CDC or directly from the manufacturer, but you're receiving it to a central supply, we also have a track and trace app that allows you to track its distribution from the central supply to other clinics or sites that are actually giving the vaccine out. So we have that capability as well. And then from a reporting standpoint, we've built in reporting KPIs for all of the CDC-based reports. And then you can always create or modify any of them as per the individual state requirements as well. So this is kind of broad summary of the solutions that we have from our COVID platform. I will kind of show some of it right now, and then we can open it up for questions. So I will be a bit high level here and give you a sense. So this is kind of the assessment piece and the case management aspect from a back to work standpoint. So here, when someone logs in, they might be a contact tracer. They're going to see any cases that have been triggered by an employee reporting that they either tested positive for COVID or have some symptoms that indicate they could be positive. So this will trigger different types of cases. We have contact trace, positive test, positive symptom, and you'll see some breakdowns here, as well as for the active cases where they are in the process. You can see, the cases that were reported this week. If you have multiple team members who are doing the case management side, you can see which cases are assigned to who. And then we have a list of all of the open ones as well. So this is a native dashboard. It's working off of the data that is from the common data model. And if I open up one of these, I can then go and see some details about this individual employee. So I can see some of their basic demographic information. I can then see their personal details, their work details, and I can see the contacts that they've reported through their app and how frequently they interact with them. This is a helpful tool for contact tracing. So these will actually go and create a contact network. So if I'm a contact tracer and I know I need to reach out to everyone who has come in contact with Bedelia, I can let them know that they might need to quarantine, or I can ask them how they're feeling as well. And then actually directly from here, I can call or email any of these people. It's all direct links to Outlook, Teams, and whatever phone service I have integrated. You can also see the assessment history that has been reported from the individual's app. You can see their responses, and then you can see what symptoms they've reported, any tests that they've had. So this individual's had COVID-19 test and the antibody test. And then we can also see their active case. So if I open up this, I'll get a full case management view. And this is where you can define a number of different steps for responding to a case. So I could see my symptoms again here and the tests. If I want, I can send out a facility notification. So because Bedelia works in the sales and marketing team, this could be automatically sent out to everyone else within the department. And you can configure different messages for different teams and what they should say. Then we have the contact tracing piece here. So this is where a contact tracer can actually call the individual, ask them, who they've interacted with recently, and then they can create a relationship or a contact trace record for the individual. So here we can see Bedelia was in contact with Aaron Marcus on the 2nd of September. And then once these have been added or we know the details, then they're going to generate a timeline here of all of the interactions. And based on this, we can send a contact tracing notification out to those individuals to quarantine or to get a test. And then you can create different plans, and then you can resolve the case. So this just allows you to have kind of that full management and make sure that anyone who needs to be in quarantine is following the procedures, and that you know anyone else you might need to interact with. So then from an actual assessment standpoint, I would like to show what it looks like for the user to report their symptoms. Oops. Actually, looks like my phone screen is not showing right now. But I'll show anyways the vaccine piece now. And we have just a few minutes left before I open it up for questions. So this is the vaccine management aspect. We have a number of different dashboards here, so we can see the vaccine overview, breakdown of patients by phase, by risk category, how many appointment slots we have over different vaccine clinics or stations. We can see the appointments by status, whether they're checked in, booked, or no-show. And then we can see an overall status of the different patients or employees by their vaccination or immunization status. So we have, a few of them are complete, some are not started, some are partial. And then if we open up some of these other dashboards, these are all pre-configured dashboards, and then you can always edit them during implementation or create new ones. But these will just give you some of these kind of reporting metrics. And as you can see, we have a full report of all of the individuals who have received the vaccine. And if you're tracking it for any of your own employees, you can track them separately from your patients. And then your employees can actually have a separate work profile where they're actually, you can give them different permissions for giving the vaccine, but then you can also document their status as a recipient of the vaccine as well. So you can see whether this individual is high risk, what's their immunization status, what phase are they assigned to, and a number of the other CDC reporting metrics here. You can also record or document if anyone does refuse the vaccine and their reasons, which is part of the reporting requirements as well. And then if they do register or you schedule an appointment on their behalf, you'll see their assigned slots. As rescheduling is a big challenge due to the inventory problems that were discussed by Kathleen. We also have the rescheduling aspect as well. So a scheduled appointment can be canceled and then rescheduled on request. And then we can also see any of their reactions that they reported or vaccinations as they are documented. We're also tracking, the adverse reactions. And then from a scheduling standpoint, we have a full inventory-based appointment generation mechanism where you can very flexibly, but also in advance, basically create your appointment slots. You can define how long it'll be, how many different stations or rooms you have to give vaccines at the same time. You can see how many kits you're expected to have that day based on the vaccines you've ordered. And then you can assign the manufacturers and update your inventory status. So all of your appointments are going to be based on the inventory you have according to whether it's available or on hand. So that just helps to make sure that you're not over scheduling appointments and you're not having enough inventory. And then if anything in your inventory changes on the day of, you can always update your inventory status very easily, or if you received it on hand, you can update that you say ordered 10 originally and you had 10 available to promise, but only 8 of them arrived, and then you can always update that you got 8 on hand. So this is a high level of kind of the vaccine piece. You can see that we have all these different phases defined, and then you can assign eligibility criteria for each phase, and then you can have assessments given publicly to patients or internal to healthcare workers, and then it will automatically assign them for a phase, and then based on their phase, they can schedule or not schedule an appointment. And then from an assessment standpoint, our assessment mechanism is highly configurable, but I just wanted to give you an example of how they can be very easily tailored based on the kind of scenario. So for example, an employee assessment, you can define what questions you want to ask and the type of question, whether it's single select or if it's yes or no. And then you can also add symptoms and locations that this assessment would be relevant for. And then you can define all of the options, and based on each of these options, you can define whether that would mean that the patient is high risk, and then also which phases that they would be assigned to. So it's all very configurable and can be really applied in a number of different contexts as we've discussed today. We have really the same similar mechanism geared towards the test scheduling as well. So it's all inventory based and it's very flexible and can adjust day of as inventory changes. All right.
Sarah, this is Kathleen. I was just going to comment. That's like fantastic, because one of the biggest issues that organizations are finding is that the doses that have been committed to them through the federal government have not been the volume that they've received. So they may have scheduled 1,000 appointments and they only get 800 doses, and then they have this situation, as you can imagine, where they need to scramble and figure out what are they going to do with the 200 patients they booked to come in, and how are they going to reschedule them as they're scheduling additional patients. So that's good stuff.
Yeah, it's absolutely a huge challenge. And I know a lot of our customers over the past year have faced those situations. So we've tried to take whatever we've learned from those and kind of build in that flexibility within this platform. All right. I think, yeah, this is pretty much what I was planning to show from a high level. So I think we can open it up for questions now.
Perfect, perfect. So I don't see any questions posted in the chat just yet, but there were a couple that were sent in advance. So if it's okay, I will ask those to both Sara and Kathleen, and let's tee it up here. So one question came in that said, when deploying these solutions, do you have to implement the entire solution, start to finish, or are there certain modules or certain parts of the solution that maybe you just wanted something that was more on the patient side versus something that was on the provider side? And I guess that's probably a question for Sara.
Absolutely, that is a great question. Yeah, so the great thing about this whole COVID platform is very modular and very flexible. So while we are providing a lot of different functionalities for a broad range of scenarios, you don't have to go live with all of it ever, but you can also roll it out in a phased approach as well, where you kind of start with one scenario. Like I know right now, a lot of healthcare organizations are starting with the vaccine management just for their internal employees. And then once their internal employees are vaccinated, or we get enough inventory that we can expand it out to some of the later phases, then they're planning to kind of update it, provide a public-facing portal, and implement some of the other aspects of the vaccine management solution. But because of the time constraints, they were able to just go live in about 3 days with their own internal employee scheduling, and are using that today while they plan out their future rollouts of the more broad and general public kind of functionality. So yeah, absolutely, it's very flexible.
Oh, perfect. Thank you. Thank you. Thank you. Another question that came in, there are so many data points to look at when rolling out a vaccination plan or a vaccination management plan. And I think this one probably is for you, Kathleen, though it might be for Sara as well. As a healthcare provider or an organization, how do you really identify what that key or critical metric is that is most relevant to your organization? There's just so much data to get through.
So maybe I'll go first, Sarah, and you can add on. So I would say look at what you already have as far as organizationally via supply chain or ERP. How do you currently do your procurement and your inventory management? Are you going to be able to adjust that? And what are the gaps that you have? Because you will definitely have gaps. Look at the, what are your needs for scheduling and how you want to roll out your scheduling. And then, identify what do you need as far as your data platform, and what capabilities do you need? How are you going to work to do the prioritization scoring for the different phases that have been identified? And essentially, how are you going to look at your, I think Sara really mentioned it, right? How do you look at your demand forecasting? How do you look at your adverse patient events, or your patient monitoring? Because essentially patients need to report back if they have any symptomatology, and how are you going to report that then back to the authorities, the CDC, and the HHS? Every state has different requirements for reporting back, as well as federal.
A lot to keep track of.
It is. Sara, you probably have more specific. I think I'm more of a broad platform kind of discussion.
Yeah, no, I think that was really helpful. I think from our perspective, we're just doing everything we can to make sure that at least the government mandated data points we're capturing and providing in an easy format. So whether you're integrating with the system and pushing out those reports, or whether you're just simply downloading them as an Excel and able to share them via whatever other mechanism, we're trying to make sure that is very easy. And then the beauty of something like the common data model is that you're able to pull in data from a number of different systems. So even if you're using different apps or different power apps, you actually are storing all of your data in one place. So it does help a lot when it comes to kind of pulling some of those very specific reports for these different scenarios. And then, yeah, I think another thing to just keep in mind is kind of when does it make sense to enhance a solution that you already have, and when does it make sense to get something new? Like, I know a lot of the hospitals, they don't really track they don't want to add all of their employees into their EMR in order to track whether they have a vaccine. So that's why a lot of them are choosing to look towards kind of an add-on solution just for the vaccine management, because if you have 80,000, 100,000 employees, just the data migration alone into the EMR would be a big challenge.
Yeah, Sara, I'll just add on to that as well. Not everyone in your catchment area may be a patient that you currently have, and they may not be in your EMR. So you may need to be able to accommodate, especially the homeless or folks that have, the diverse population, right? Disparities. So keep that in mind as well.
Absolutely, absolutely. And then definitely call center ability, which we've provided for every one of our apps, is super important from that standpoint. Obviously, we're in a kind of digital first era, but for people who don't have as much access to technology, it's always important to have that capability as well.
Great. And then if we can squeak in one more question, a question came in from Tom on the call. He says, thank you for the great information today, but then also had a question. How long do you see contact tracing being valuable? We've been bad at it to date, but it seems like it has increased in importance as we get greater control. And he was curious on Dr. McGrow's view on that.
Yeah, that's interesting. As someone who, in the interest of full disclosure, has actually had COVID and had to do contact tracing with my family, it was, thank God, very limited, but I can't imagine as we move forward, Tom, the more people, once we start opening and going into, the different areas, offices and hotels and airports and things like that, I think it's going to get more and more important. And then, as we think of these new variants, how are the variants going to impact the vaccines? Are they going to cover the variants? So I think that we're going to be doing contact tracing for a very long time, in my opinion.
Okay, and we now are at the top of the hour, so I just want to thank everyone again for joining us today for this webinar, and a special thanks to Kathleen and to Sara for sharing your expertise and your knowledge. The deck will be available as well as the recording on the Mazik Global website by close of business tomorrow. I will send out an email to everybody who is registered and everybody who did attend today, just to let you know that that's there. And everybody have a great rest of your day and stay safe.
Thank you,
Sara.
everyone.
Don't forget to wash your hands.
Thanks, Kathleen. Yes.
Thank you.
Take care.
Bye-bye.